Hi, my name's Abby Kraft.
My name is Ethan Malchak.
And our drug is Bivalirudin. Now, many people have heard of a heart attack before, but not many people know what causes it. What causes a heart attack is when a blood vessel leading to the heart is blocked, and this does not allow any blood to flow to the heart, and therefore it is lacking oxygen. So what we can do is give Bivalirudin, which will help prevent those clots from happening. This is the structure of Bivalirudin, and clinically it will come in two forms, either freeze-dried powder or as a solution. Now, how we administer it is intravenously through the veins. We will give this solution, and it must be prescribed by a doctor and will either be administered by a nurse or a healthcare professional. And we will usually give this drug before or after a heart surgery or an angioplasty, and it will help prevent these clots from forming and allow the blood to move smoothly to the heart.
So how it works is, first we have to start out with our normal blood vessel. This is a normal blood vessel without a clot that is happening. And then over here, we have a blood vessel that has a clot inside. This would be intrinsic, it is inside the blood vessel, but the platelets and red blood cells go to the site of the injury and they form a big clotting, and then fibrin is the net forming that forms around it to strengthen this clotting and make it so the blood cannot flow freely through. Without fibrin, the blood would just go straight through because the clot would not be strong enough. So, how it works is we start off with the intrinsic and extrinsic pathways. Extrinsic would be outside cut that could happen on your wrist or your hand, and intrinsic would be an inside cut that could happen during surgery or could cause excessive bleeding in there. And so both pathways lead to the formation of thrombin. Prothrombin is already in our blood, and then there's a multitude of factors that turn it into the enzyme thrombin. Thrombin is then used to turn fibrinogen into fibrin. Fibrinogen is already in our blood, and thrombin is that enzyme that catalyzes it into fibrin. And fibrin, like we said, was the cross-link that forms around the blood clot to strengthen it and make it so the blood cannot flow freely through. So this is where our drug Bivalirudin comes into place. It is an active inhibitor of thrombin, which would then cause this all not to happen. So fibrinogen cannot be turned into fibrin, and that would make that inactive. And without fibrin, we have no cross-linking happening at the site of the blood clot. And so that does not happen either. And so how the mechanism works is Bivalirudin connects to thrombin by the active site and then wraps around to block out exosite 1. Exosite 1 is where fibrin is released after fibrinogen connects to the active site of thrombin, and so that would form these crosslinks. But with Bivalirudin blocking both the exosite 1 and the active site, fibrinogen can't even connect to thrombin, so there's no forming of these crosslinks. But Bivalirudin would not be able to be used unless it was reversible. We cannot have excessive bleeding at all times because we need the cuts to stop bleeding, so we need to form clots. Here we can see that Bivalirudin is actively reversible and leaving thrombin, making the active site open for fibrinogen to connect, and then fibrinogen will release fibrin from exosite 1.
Like any drug, Bivalirudin does have side effects. It is known to cause bruising, and it can also cause excess bleeding since we are preventing those clots from forming. People have been known to cough up blood or have blood in their urine or stool. It also causes nausea, and it can have arm, back, or jaw pain.
And so what's next for Bivalirudin? Bivalirudin, like most drugs, is not perfect. It cannot be used in every single case and we must use other anticoagulants at certain times. A main fault of Bivalirudin is its very short half-life. Bivalirudin during a long surgery may not be the most effective because it could wear off, and then during a surgery you don't want to have blood clots forming and stopping the process of healing. And so this could cause problems during high-intensity surgeries where they may take a long time and we cannot use Bivalirudin. And then another shortcoming of Bivalirudin is there is no antidote to excessive bleeding. The main point of bivalirudin is to stop these blood clots from forming and let the blood flow freely. But if you are taking it in the hospital and then you are able to leave the hospital later that day, it is not healthy to get a cut and have it just bleeding the whole time, and there is no way to stop it. So there is no antidote to stop the bleeding if bivalirudin is still working on the patient. And so, to fix this and to fix all these problems, people are working with bivalirudin to combine it with other anticoagulants in order to make it the best drug possible and able to be the most optimal during all cases. That is what the further research is doing for bivalirudin. Thank you.
That's all.
That is all.